welcome once again to New Day here on TV3. It's Christmas Eve. Imagine. So hopefully by now you're in the Christmas and festive mood and you're enjoying yourselves, and well, if you're off work, kudos to you. Some of us still have to work, and this is what we're doing this morning. Now we're in the health segment. Yesterday we were talking about high blood pressure. Today, from the video, if you may have noticed, we're talking about strokes. Our aim on New Day here at TV3 is to ensure that we see you in 2014. So what we're doing is trying to give you all the advice possible so you can make it through Christmas and be here in the new year on a new day and experience more. To help us discuss this particular topic, and myself, is Dr. Ankobia, who was here with us yesterday as well. Good morning, Doc. How are you?
Good morning. Good.
Thank you. Now, according to the latest World Health Organization data that was published in April 2011, stroke deaths in Ghana reached 13,780, or 7.34 of the total deaths that occurred within that period. So obviously this is something that is high risk. We're facing this daily, and we have to do something in order to avoid it. Is avoidable though, isn't it, Doc?
It is, and one of the startling statistics about stroke and about medicine in general and treating this cardiovascular disease is that the proper treatment of hypertension decreases the chances of stroke by 70%.
Wow.
So if there's nothing at all for people listening to take home, most people who have stroke due to hypertension. We already spoke yesterday about cardiovascular risk. Mm-hmm. We know cholesterol, diabetes all lead to building up of plaques, but specifically stroke and hypertension is very significant, and we can reduce the incidence of stroke by treating proper hypertension. In fact, anytime you hear somebody has had a stroke, most likely if you investigate, they were hypertensive and they were not taking their medicine or following proper medical. Right. Because it does prevent having stroke. So that's a take-home message for all the listeners.
So if you have high blood pressure, you need to make sure you're checking it out and maintaining it. Yeah. Okay, well, I mean, we just saw that video there. But just to break it down for us in a very layman's term, how does a stroke occur? I know it starts from the brain, but can you just break it down a little bit for us?
As you all know, there are two parts of the body, or two organs of the body, that are very sensitive to blood flow. This is the heart and the brain. They can't, because the way they function, they cannot withstand any interruption of their blood supply. So obviously, if you had a little blockage in your artery in your heart, you have a heart attack. Mm-hmm. The same way, the brain, the way it's structured, it cannot withstand any sort of being deprived of oxygen or glucose. Therefore, anything that happens that causes it immediately causes damage. Right. So the issue about stroke, which is otherwise known as cardiovascular accident, or otherwise known as, now we want to call it brain attack, when we might explain that later why they want to compare it to heart attack. So brain attack makes it urgency to do. So the main thing is that the brain is very sensitive to deprivation of oxygen and glucose, and when you deprive them, the cells, of oxygen, then they immediately die, and that is the basis of having a stroke.
We saw from the video some of the causes of stroke are very similar to the high blood pressure. Yes. And the reason why you're here with us today as well, and reason why we're talking, specifically heading this topic as Christmas and stroke, is because of the way we seem to overindulge over the festivities. So what are some of the things that we should be avoiding in regards to what happens over the next couple of weeks that could reduce our risk of high blood pressure, which will lead to stroke?
Yes, and you already gave the startling statistics about stroke rate in Ghana, and I'm sure everybody watching has an experience of family member or somebody who's had a stroke. And we know, as the video showed, 80% of all strokes are called ischemic stroke, not ischemic.
Not ischemic.
I think because he was British.
Yeah, that was the British word. Ischemic, yes.
Ischemia means that there is a narrowing of the vessel and the blood is not flowing through. Okay. So that, as the video explained, is due to atherosclerosis. So over a long period of time, when plaque builds up and narrows the arteries, then the blood flow will decrease, and that is what is causing that. Now, the other 20% is what is called hemorrhagic stroke, where the blood vessel ruptures,
right,
and the total cutoff of blood to areas of the brain, and also leads to compression of certain parts of the brain by the blood, and so on and so forth. So those are the two main ways that it is. And of course, since when we talk of cardiovascular risk, it's the same thing with diabetes, hypertension, smoking, family history, and age.
Okay, let me ask. I mean, when we think of stroke, we always think of the older person getting stroke after a certain age. But is this something that young people need to be, I guess, cautious of? I know you can prevent it by how you live, maybe your diet and stuff. But is there something young people in particular? Does it affect a lot of young people?
Well, it depends on what age we kind of. I mean,
say 40 plus,
40
and then
plus,
under 40s.
Yes. Most of the time there are things like malformation of blood vessels, we call arteriovenous malformation in younger people, where the blood flow is disrupted, so you can't have it. And the key thing is, he had one.
Wow.
Yeah, he was 26.
Wow.
Yeah.
So that is a major reason. So anytime you hear somebody around 40 or less than 45 having, you always think there is something else going on,
right,
rather than the usual atherosclerosis or something going on.
Right.
And there's some of them is called aneurysm, ruptured aneurysm, which can also cause subarachnoid hemorrhage. You have a part of the blood vessel bowing out, and as a result of the pressure rupturing, and that can also occur in young people.
Okay, I mean, once you've had a stroke, I have a very close family member who had a stroke almost 20 years ago, and even though she now walks with a limp, she's okay. How does, once you've had one, how do you manage your everyday life once you're at least through your healing process?
Well, but let's move back a little bit to the acute treatment of stroke, because I think there's a lesson here, and I'm reaching out to all the young doctors also out there to listen to this, because one of the major things that happen in a stroke is that the blood pressure can go up. Either the blood pressure is up and the stroke occurred, or the blood pressure will go up as a result of the brain's mechanism of maintaining perfusion. When you have a stroke, the brain tissue is divided into three. There is the area which has been destroyed or been deprived of oxygen. Then there is the normal part of the brain. Then there is in between an area called penumbra. The penumbra area is trying to prevent further damage. And if you see a stroke person recovering, it means that for some reason the penumbra area has recovered.
Right.
The area that is damaged, but the penumbra, if it recovers more, then the function is that. Now, here's the unfortunate thing. If a person goes in and has a stroke and somebody sees them in a hospital and the blood pressure is 200 over, say, 110, people get immediately alarmed, and then they lower the blood pressure suddenly. And this is bad, and this is like, because what is happening is that the way the blood flow in the brain occurs, there are mechanisms that it sets into motion to allow it to get the adequate pressure.
Yeah.
Oh, wow.
So when the pressure increases, it needs more perfusion to withstand, and it takes time for it to recover. So if you lower the blood pressure immediately, you're going to kill all the penumbra area. So what is happening in the guidelines, and these are not written in many medical books, you have to be doing like pulmonary and critical care medicine to get a patient in the intensive care unit, monitor them carefully, and bring the blood pressure down very slowly.
Gradually.
So the guideline is, if you have a stroke and your pressure is high, within the first 24 hours, bring it down to about by 15 to maximum 20%. So if it's 200 over something, you get to 170, you're fine. But the tendency is we all think the normal blood pressure should be
even lower,
and so
it's kind of like the brain fighting for itself.
Yes,
really, it goes into defense mechanism where it tries to reoxygenate itself.
Yes. And I think this is. I don't want to say this is only in Ghana. Been in U.S. for 30 years, and the same thing occurs. People who are not at that point would do something and worsen the situation. The other thing that should be thought of is that is the feeding. I mean, I've had 2 patients here. I'm pulmonary, but unfortunately, I had 2 very bad patients with stroke. And one of them I was called to a hospital to do a consultation. And when the young doctor was trying to stick something in the to feed the patient, I said, please, try, let the patient start for 24, 48 hours. It's okay. And then don't try to, because the thing that might kill the patient is they can aspirate. Most of the time, stroke doesn't affect feeding, but in the initial phase, somebody may be choking and not able to eat.
Right.
But if you just give them a little bit of time, most people will recover.
You made a good point there, doctor. And when you're saying you're talking to the doctors and the young doctors here, and it just doesn't happen in Ghana, it happens anywhere around the world. This information, to me, it is critical. Is there a way, or is there some journal you can write that to be distributed to the doctors out in Ghana? Because this could essentially help in the way doctors are treating stroke patients.
Yes, I'm sure the Ghana College and they're teaching postgraduate students and all that, but I'm just saying a general practitioner may not have
this information
training to know that is how it is. Yes, and if I have a chance, I will probably write in John.
Okay. Oh wow. Okay, I'm like.
Doc, now we know, or some of us realize that when a stroke occurs, one of the identifying things that we see as third parties is a form of paralysis, whether it be part of the face or part of the body or one side or whatever the case is. Is that because of the effect that it has on the brain and the functioning?
Yes, as you should have done biology. There is a map of the brain that shows that each part of the brain controls some function.
Parts of the body, yes.
So therefore, if the area that controls the upper arm is cut off, then your upper arm will move.
Right.
So if the lower, so that is how it's called homunculus, and it's just a design of the brain that every part of the brain, for speech, for vision, for functioning, and therefore if there is a stroke and it affects a particular part of the body, that controls. Now the big vessel, which is the middle cerebral artery, which controls the movement, that is the one that is commonly affected by stroke. That's why the weakness occurs onto that side. Yes.
Wow. Okay, so bringing it back to Christmas and the advice that we have to give to Ghanaians once again, because obviously we want to keep everybody healthy and we want to ensure that they keep on watching our show, not any other show. What are some of the stuff that we should be doing over the Christmas to avoid strokes, high blood pressure, and heart disease?
Well, first of all, I think part of it is us postponing illness during the holidays. We stay home and say, I can wait until after Christmas. Please, if you do have any neurological thing that you don't feel comfortable, please seek medical help. There is a sentinel event, we call it in medicine, or you call it a warning sign, and that is called transient ischemic event. A lot of stroke is preceded by a warning where somebody may just have a tweak in the finger or slight weakness, it goes away within 24 hours. And that may be this transient ischemic event is a precursor to the stroke. So if you do have some neurological thing that you cannot explain, please seek help. So that is for the holiday. Don't wait. Of course, it's not the fault of people listening. Most doctors, people have gone on holidays, nurses are not working. So during the holidays, things are not working fully. So that may not be the fault of people listening. But issue would be that the usual thing we spoke about yesterday about the heart. Remember the J curve?
Yeah.
If you binge drink and your blood pressure goes up, your chances of having this, and young people have already talked about ruptured aneurysm. This occurs when the blood pressure is very high and it can occur. If you know that you're going to eat salt to elevate your blood pressure, please stay away. And the long-term effect of all cardiovascular plaques is cholesterol, control your diabetes, don't smoke, and that kind of thing. So the usual thing to do with cardiovascular, and specifically for the brain, that be careful if you have a neurological episode, seek help because it can help. There's also a disease in elderly people called atrial fibrillation, where the heart quivers and doesn't beat well. Unfortunately, very, very common. And if your heart does that, it forms clot in the heart,
right.
And this clot can just move up to the brain to cause stroke.
There's one more question which we've had to ask. The Cincinnati Stroke Scale. Please explain this to us.
Yeah. Well, it's the Cincinnati Stroke Scale has been worldwide accepted and validated as a very reliable way of suspecting that somebody has a stroke.
Okay.
In the sense that it's a pre-hospital assessment that can be done by anybody.
Okay.
So we can teach everybody watching right now.
Do we have anything to show on that?
No, I don't think we do.
So
it just came up.
Okay. Basically, there are three things to do to know if a loved one near to you has had a stroke.
Okay.
The first one is speech. The common thing that we say in English tell the person to say, you can't teach an old dog new tricks.
Okay.
I'm sure we can get different ones in Hausa and Ga and all that. I don't know yet how we're going to construct that. But just tell the person to say a sentence, and if they cannot speak, that's one.
Okay.
The second one is called the facial droop. So you let them show their teeth by doing that, and if you see one side of the face is weaker than the other, you know it's stroke. And the third one is called arm drift, where they put their arms up and close their eyes, and you see that in stroke, the weaker side will
start to fall.
This is almost 95% certain if all three signs are there.
All right, so
even if one or two, yes. Speech,
yeah,
arm drift,
and facial droop.
To test for weakness, just show me your teeth, and you see you look at both sides of the face, and the side of the stroke will look weaker or different from the other side. That is the Cincinnati Stroke Scale.
Wow. Oh, thank you once again, Dr. Ankwabia, for coming in. And we have to remind you all that our health segment is brought to you by Lipton Tea, inspiration flowing from nature. And once again, Doc, we have got gifts for you.
Is it different from yesterday?
Let's hope so.
Lipton is giving away all the Christmas goodies.
And I have to thank TV3. I think I'm now a TV star. Thank you.
We're going to keep it in the family for you. Sandra's already doing her part.